replacement. Or this is what we developed in our company, making an individualized trochlear cap. And this was possible because of a very nice contribution between different people and companies. For example, this is the work of the Premet, and big shout out to Zsolt, because they are very nicely manufacture all these implants. Also at the LimesVet clinic, we have a very professional veterinary surgeon, Antal Seregi, who performs these operations, and he's a leading surgeon in Hungary in orthopedics. So let's see what is the advantage of that. You can see that basically one of the main advantages that we don't need to remove the trochlear. It will be directly fit on the trochlear part because we custom made all of the prostheses. So we can shape the trochlear ridge in their height, length, and shape. And we have several options attaching with latticed cylinders or surgical screws, or together the two. And of course, we have to do the different soft tissue and bone reconstruction technique as well. Let's see some examples. So we can see a grade 3 medial patellar luxation in a pug. You can see how the implant looks like on its surface, and the pre and the post-operative state with the implants. You can see the tension wire brand on the tibial tuberosity transposition. And just 5 weeks after the surgery, this is how the dog already walking. So you can see it reduces the pain because the implant and the patella has a direct contact, and we don't need to glide on an incised surface or a carotid surface. And another case in a pulley with grade 3 medial patellar luxation and cranial cruciate ligament rupture, you can see how the implant was embedded and fit to the trochlear. And preoperatively, this grade 3 patellar luxation, and postoperatively, in this case, you can see 1 lattice and 2 surgical screws, and the TPLO was holding. Or you can see different cases because we have a few dozens, like a Pomeranian, a Yorkshire Terrier, a Chihuahua, or there was a 65-kilogram Moscow Watchdog, which we had to make the trochlear cap, so this trochlear implants. And by assessing how actually the implant will behave, or what is the anatomy, first we can investigate, based on the 3D models, the general morphology of the patella and the trochlear. Then we can do thickness analysis. So the same bones, we can evaluate where will be the largest or the smallest part. And even though we can make a step further, because we can perform density analysis, and you can see also it's a 3-dimensional model, and we can see actually where is the most dense part. And even though we have a wide part, we can see that where exactly we should insert the surgical screws, or where should we perform the osteotomy. So all of these makes a different picture for us and helps us in the surgeries.